So, Dr. Anderson, I thought NDs were natural. How come they can prescribe drugs in certain states?
Yeah, that's another question I probably get every day in clinical practice. And really the genesis of that is, if you go back almost in every state license, although we began as what were called drugless healers 100 years ago, before there were very many medications, even if you go back to the licensing in the state of Oregon in the 30s, 40s, and 50s, they would allow any medication that came from a natural source, so penicillin, belladonna, things of that nature. So it's really always been a part of naturopathy, just it wasn't a very huge part. In modern times where there's so many drugs and so many agents available, the way that I look at it and the way that I speak to my patients about it is that sometimes you have a problem that is so specific biochemically or pathologically or life-threatening that you have to have an agent that matches that level of pathology. So for example, if we have a patient who, for no fault of anyone's, is just having a bad reaction on a day, or in our case, we have people come from another provider, they've gotten a drug at the other provider, have an allergic reaction, we have to use a drug to reverse the allergic reaction. The other thing in our profession, we have the idea of a therapeutic order, and so our goal is not to start with drugs, but our goal is to use whatever tool is appropriate at the time that it's needed. And what I would say is, in general practice or family practice type naturopathy, that might be 10 or 15% of the time that a drug was really needed. Examples are someone who has asthma needs to have a rescue inhaler. It's not only part of the standard guidelines, it just makes sense for keeping them alive. And without prescriptive ability, you can't do that. Somebody who has a very acute infection that is far beyond the reach of most natural medicines has to have an antibiotic that works. So there's just times where it's very necessary for the health and safety of the patient.